The grades are in, and the news is both good and bad when it comes to emergency care in Iowa.
A group of the nation's leading physicians says Iowa does well when it comes to public health and injury prevention, but the outlook isn't as good in several key areas. Fox 28 News reporter Jason Hackett joins us live at the University of Iowa Hospitals and Clinics with more. Jason.
Yeah, guys, we spoke to doctors out here. They say you would think that Iowa is on the right track, ranking 11th out of 50 states in terms of emergency medical services with an overall grade of C. But it's once you peel back those numbers that you see we could be in a lot of trouble.
Above the grade, but we certainly have a long way to go.
That basically sums up where Iowa stands in terms of emergency services. Dr. Hans Haus serves as a board member for the American College of Emergency Physicians. He says despite Iowa being above the grade, there are some places where we fall below it.
We have the single lowest number of emergency physicians per capita in the country. We're dead last.
Part of that has to do with emergency physician residency programs. UI has the only one in the state, created about 10 years ago, but it only accepts 9 people per year.
Take a long time at 9 residents per year, 9 doctors per year to fill all the demand of all the emergency departments in Iowa.
Iowa is near the bottom when it comes to specialists like neurosurgeons and plastic surgeons within ERs. With the residency program being so small, you have to look outside the state for them. But
it's hard to attract physicians in those specialties to some areas and some states.
Dr. Miller, the director of UIHC Emergency Services, says manpower is what they need as Obamacare gives more access to care.
When patients call up their family doctor with an acute problem, 4 to 5 times, they're going to say, go to the ER.
Could lead to nightmarish wait times and the worst case scenario, hospitals closing their doors for good. Doctors say frivolous malpractice lawsuits are also a concern. They say Iowa's current legal landscape harms doctors, so until those laws are changed, doctors will continue to stay away. We're covering the corridor tonight in Iowa City. Jason Hackett.